Hey, deserving listeners, a lot of you have been asking me to react to the Netflix miniseries called Adolescence. So I started watching it, and episode 1 and 2 did not have anything in it that I thought I could offer regarding my expertise. But upon starting episode 3, I realized why so many people are asking me to react to this miniseries, because this is a psychological assessment or a therapy session. So let's watch. My name is Dr. Kirk Honda. I'm a therapist and a professor. Let's see what happens.
And steer it a bit into what you think of your dad and your granddad, for instance. The type of men you think they are. Rather than saying, so, Jamie, what do you think being a man feels like?
So I thought I would catch you up in case you aren't watching the show. Of course, I recommend watching the show before watching my reaction video. This is a 4-episode series, and episode 1 takes place the day after a young teen named Katie. I think all the kids in question are about 13. So Katie was murdered, and then the episode 1 takes place in the morning of the next day. And it starts out with Jamie, who we see here, the boy, is 13, and he's being arrested. Episode 3 begins 7 months later it's called the Standling Secure Training Center. I think that means a juvenile detention center is what we would call it in the United States. He has not been sentenced yet. And so we meet Jamie's, the boy, we meet his clinical psychologist. We see her ID tag and it says clinical psychologist. She is meeting with Jamie to assess him, and she says that she is there to assess him to write the pre-sentence offense report, which the judge will read to get a better understanding of Jamie and whether or not Jamie understands the charges against him. I've done that kind of work in the past. I'm trained as a forensic psychologist, and this is a very common sort of thing that forensic psychologists will do. She has been asking him about masculinity and about his father and what his father and uncles and the men in his family, what they are like. And Jamie has been resisting.
So, Jamie, what do you think being a man feels like?
It's not a trick. It's just a conversation. So do you think it would be okay if we speak about your dad a bit?
The other thing I should mention regarding the context that we know so far is that Jamie, the boy here, and Katie online were having some kind of conflict, and he was exhibiting Andrew Tate-like talk, red pill kind of talk, 80-20 stuff. And then Katie was in his comment section or something calling him an incel. I won't go into detail on all that. You can listen to all my deep dives on that topic, not only toxic masculinity, but also incel, MGTOW, pickup artist, red pill. I've been making episodes on that for 12 years. So that seems to be possibly the inciting incident that led to them in person having conflict, which led to him killing her.
You get the best money for emergency plumbing out of hours, you know.
Is he funny?
Sometimes.
Loving?
No, that's weird.
Angry?
I suppose.
So we're hearing a little bit about the specifics in terms of how Jamie sees his father. We did see a fair amount about the father and his interactions with Jamie, and there wasn't anything noticeable regarding toxic masculinity or masculinity in general. And if you don't listen to my podcast, I want to be clear that there are positive, neutral, and toxic elements of masculinity. Sometimes people think that the phrase toxic masculinity is an indictment on masculinity in its entirety, which is not the case.
Maybe, or maybe he just didn't want me to see him looking.
I should mention that I have a lot of expertise working with kids this age. In the beginning of my career, for the first 10 or 15 years, I've been a therapist for almost 30 years now. And the first 10 or 15 years, about half of my clients were teens and their parents, and the other half were adults and couples. And I found that the shit would hit the fan, so to speak, psychologically for people when they're about 12. That's when things start to get a little bad. 13 was when things really ramped up, and 14 was when there was a pinnacle of the problems, whether it was defiance or drug use or grades slipping or hanging out with the wrong kids or depression or addiction or drug dealing or shoplifting or gang involvement or violence, running away. These were the kinds of things that I was, family conflict, of course. And some kids would even abuse their parents at times. So I would see that anecdotally anyway, in terms of just averages. So this fits with that. And I would be called into the situation. Either the family would come to my office by the time the kid was 14, or the government would actually hire me to go into the homes to help with some of the most difficult situations. And I would work with the whole family because that's how I'm trained, and that's what I believe often is needed to help the teen, right? Along those lines, what I'll say is that this session is both accurate in a lot of ways, in a way that I very much appreciate, because accurate depictions of therapy are not often in TV and movies. But it's also inaccurate in a sense. I mean, could this happen? For sure. But they are, I think, accelerating things a little bit so that they can have something happen. If you actually filmed or produced a TV show that was realistic when it comes to working with a 13-year-old, it would be filled with so many boring scenes of just rapport building and hanging out and watching YouTube videos and playing games and stuff so you can get to know the kid and get them to feel comfortable with you. And, it wouldn't be very watchable. Although it's very intense work, it's very meaningful work to us as therapists, it's not very interesting to watch. So there's a little bit of acceleration. Could this happen? For sure.
Discussion. Maybe I want you to.
Do you?
It'd piss you off, that, wouldn't it? You'd have to go home and then come back again.
Jamie, if you do not sit...
Look out! Fucking want to sit down!
Okay, so this sort of thing would happen now and then. It's not typical, but clients of any age can have outbursts like this. And I think we're maybe being told by the storytellers here, the scriptwriters, that he has a lot of feelings right now. He's really upset about being accused. He doesn't like being in this facility. It sounds like the facility is both a mental health facility and also a detention center. I'm getting that from context because I don't know the terminology in the UK. I think we're also being told that Jamie has some anger issues and also has perhaps some toxic notions regarding masculinity or what a man is supposed to be like. I think we might also be learning that when you start to get into his relationship with his dad and ideas of masculinity, it's a sore spot for him, and he has shame around it and hurt, and his way of dealing with it is the way that his dad deals with this sort of thing, which is probably the way that his dad's dad dealt with this sort of thing. I think that's what we're being told. And by the way, I want to mention something very briefly because there's really not enough time to get into this, but there is a huge difference between psychotherapy, talk therapy, counseling, and providing an assessment, a forensic assessment, which is what she is conducting. She has repeatedly mentioned that she is there to conduct an assessment. She's not there to provide therapy, and I worry that people will think that this is a therapy session. I don't know the ethics or standard of practice in the UK. I'm guessing that it is the same or similar to the United States in that when you're providing a forensic assessment, you have to be very clear both to the client but also internally regarding how you think about it, how you approach the client. And also you have to make sure that you conduct the session or the assessment or the meeting in a way that is very clearly not psychotherapy. Because I imagine a lot of people watching this would actually assume that this is a therapy session, but it's not. It's an assessment. And although her responses might be therapeutic, there might be elements of therapy-esque reactions from the clinician what she is doing or what she's supposed to be doing is not therapy. Now, in the process of conducting an assessment, you could absolutely be doing everything that she's doing. You could get into emotional material. It's not all just testing and dry kinds of questions. In fact, a very effective way of assessing someone is to see a display of emotion, right? You see the raw individual, you see what they're capable of in terms of their behavior when they're provoked, that kind of stuff. And the reason why we want to keep assessments and psychotherapy separate is because when we're conducting a forensic assessment, we want to remain as objective as possible, whereas when you're a psychotherapist, when you're providing counseling or therapy, you are trying to remain a bit objective, but you're also really trying to bond with the client. You're trying to build that relationship. You are wanting to advocate for them. And not in all scenarios, of course. If a client wants to do some harm to someone else or has an idea or a narrative that is problematic, we don't advocate for that. But, we bond more with them. So for forensic assessments, we want to make sure that we don't engage in that kind of relationship, not only for our own sake so that we can remain objective, so to speak, to write the report effectively, but also so we don't confuse the individual. We don't want to pull them in different directions, right? Because our report might actually involve a lot of things that they don't want out there. In a situation like this, this happens all the time, where the subject, Jamie, upon reading the report might be extremely angry about it. It could actually make matters worse for him in terms of what she ultimately puts in this report. So you don't want to trick a client into thinking that you're completely on their side the way a therapist might be. And there's a whole debate about being on a client's side. Of course, we want to be somewhat on their side, but the notion that you're completely on their side is really just ridiculous. But so there's a lot of need to keep these things separate. Plus, if you're submitting the report and it's known that you bonded in a way with the client, with the subject in a therapeutic way, people that would receive the report would wonder about your objectivity and would wonder if you're biased. So there's just a lot of reasons why those things have to be separate. So I want to be clear about that. This is at least a fictional depiction of an assessment, not a therapy session.
You do not tell me when to sit down! You do not control my fucking... Look at me now!
Oh, I should comment on what's happening here. So I've done research on difficult clinical moments for therapists, and one of the difficult clinical moments, the most difficult that clinicians will identify, are moments like this where you're literally afraid for your physical safety. It's hard for me to get out of the mindset of a supervisor and a trainer and a professor, because so much of what I do and have done over the past 30 years has been training and watching video of sessions with my supervisees. So if she were a supervisee of mine, which, maybe this character has more experience than I do, I don't know, but I'm just going to think of, or a consultation for peers. Anyway, I would have suggested that she walk out of the room, because there's no reason to stay in that. As soon as he stood up, if she said, "Hey, I need you to sit down," if he didn't sit down, especially when he did that thing with the cup and the hot chocolate, I would recommend that she pop up and she get out of the room. There's no reason to stay in that room. Plus, how can you conduct an assessment beyond that point? He's not participating. Now, she might believe that she is okay. Maybe she knows how to protect herself, or she doesn't think he's going to cross the line and actually strike her. I can't imagine how she would know that. But if I were there, or if I were watching this and I were to talk with her, I would say, you need to get out of there right away. No one wins if he strikes you, right? Obviously, you would be in dire circumstances, but it could harm him, because there could be legal consequences to him, right? So I would say at any point you need to get out. And I'm guessing that if this were a real scenario, the psychologist would do that, especially people that work in detention centers, in prisons, they have to be very careful. It is very common to conduct an assessment of a very dangerous individual, someone who is diagnosed as a psychopath, someone who suffers from psychopathy, who might even be sadistic, has a track record of exploitation and harming other people in a very callous, sadistic manner. And when you're conducting an assessment, you understand those conditions, you are dealing with people with those conditions frequently, and you know their history, you know what they've done. This psychologist at least suspects what he has done. There's a video, security video of it, and he's a dangerous individual, right? So you would understand the danger, and you would have very strict rules about how to respond. And so I'm guessing most people in her position would leave. And I wonder if there's this idea that we're always supposed to be empathetic and warm regardless of the situation. And I have to actually train that out of my trainees. One, no, not under all circumstances. And two, it doesn't do anyone any good to stick around in a scenario like that, including the client. You're not helping the client necessarily by sticking around.
Oh, there isn't a problem.
Jamie.
I shouted.
So I think we're supposed to be picking up on toxic masculinity, which I'll get into at some point, I think. Yeah, I was wondering if she was going to take a beat to relax and to center herself or cry or something. And I'm glad that they're doing that because at the very least, this character would benefit by doing that. And I think most therapists would, and most forensic psychologists would take a beat to just kind of recenter and relax.
I mean, what is it you're looking for? Is it body language stuff? Just I'm reading a book on that at the moment.
By the way, this guard has been creepy is a word that I'll use. It hasn't been overt, but he is definitely giving what I think a lot of younger people would say is the ick. And I think that's on purpose to show various different elements of problematic masculinity. And the other thing I'll say is that he is asking about body language. There's no science to support the notion of reading people's minds by looking at their body language. We just don't have that ability. It'd be nice, but we don't have that ability. And please do not believe the pseudoscientific and dubious claims regarding body language. I get it. It'd be nice to have that kind of superpower. There's a lot of bullshit about this, you know, the eye movement stuff. It's generally all nonsense. Are there things that they can say that are based on empirical science? Sometimes, for sure, but 99% of it, no.
I'm not a police officer. I'm not here to elicit a confession. I'm just here to understand. I know you think I'm trying to trick you.
I said that ages ago.
Okay, so as I've been saying, she's there as a forensic psychologist. She's there to provide a forensic assessment for the courts. She is not there to help him or to advocate for him. She's there to provide what is considered to be an objective psychological report so that the court can understand the situation better. Now, she, as a part of that assessment process, might not be explicit about that. The reason why I say this is because if I were Jamie's friend right now, or if I was a little advocate on Birdie on his shoulder, if you will, I would tell him, she's not on your side. She's not there to help you. She's not there to make your life better. She's not there to heal you. She's not there to advocate for you. She's there to provide an assessment, an objective, unbiased as possible sort of assessment. And her demeanor with you is appropriate and professional. She's not being manipulative, but don't be tricked by the culture that surrounds psychology and therapy to believe that she's a warm, nurturing presence, because that's not what she's there for.
And I understand that you need to have an understanding of my understanding. Go on, ask your questions. I'll be better now.
We'll say it's an interesting choice. She goes in strong and firm, picks up the chair, gets closer to him, and shows that she means business and she's not a wilting flower, and that she is going to meet him where he's at, I think. It's hard to know exactly what was in her mind as she did that, but, I think it was a choice maybe to show him, look, we're not going to play this game. You're not going to get all big and masculine over me as a woman and control the situation. I'm here as a professional. I'm strong. I can stand on my own 2 feet. I'm not intimidated.
Are you sure you're allowed to ask these questions?
So, you think it's normal for a 13-year-old heterosexual boy to have engaged in touching of a girl's chest and her backside?
So we are seeing an aspect of forensic assessments and also psychotherapy that for some people they might be surprised by. Questions like this might be considered inappropriate or creepy or even abusive in some ways, and they certainly can be that, even in a forensic assessment. But if they're done in a way that is in the service of an assessment and it's done appropriately and with care, then it's just a part of the assessment or a part of psychotherapy. Sexuality for 13, 14-year-olds often is a thing, and if we're going to understand people, particularly if it is relevant to the assessment or to the therapy, then it would help to have a conversation with that, to get into that sort of thing. There are ways of getting into it that are non-exploitative and non-abusive and are not giving the message that the mental health clinician is doing it for their own benefit, if you know what I mean. For us, and I like that about this, it's one of the reasons why I wanted to become a therapist, was because I found that so many conversations were avoiding the most important things that we think about or that we deal with, whether it's existentialism, grief, sadness, depression, sexuality, identity, pain, trauma. All of these topics are considered inappropriate in a lot of, if not most, if not all, contexts. And that really bugged the crap out of me. And I wanted to live in a world in which that was not the case. And I became a therapist partly because of that reason. So, this is representing that. Secondary to that, I'm trying to figure out, in terms of how this is written, what the psychologist is getting at. I think maybe two-pronged approach here. One is that she is trying to open the door to get real, because I don't think she's precisely interested in what he wants to do to girls his age if he were to be dating them. I don't think she's interested specifically in like, okay, well, what are you going to do with your hands? I think that's just the surface level. I think she's trying to get at, obviously, his ideas of masculinity and how he sees women and if he is objectifying women. And so I think one prong is he's trying to open the door and say, look, we're going to get into some real stuff and it's all okay. And I'm going to demonstrate to you that I'm not going to freak out and I'm comfortable talking about the real stuff here. And I think the other prong is that she's trying to get at how he sees girls and what he's been taught.
One of them touched my knob through my trousers.
Okay.
And I think she liked it.
And you liked it?
Another aspect to this is that as a clinician, we need to be comfortable having these kinds of conversations on a number of levels, because so often, even if you're talking with friends as an adult, to talk about this topic can, result in people giggling or having little jokes here and there. There's nothing wrong with that, obviously, with friends, but we have to be very comfortable having conversations about taboo topics. If people can't have those conversations with us, then who can they have those conversations with, right?
I've seen photos, though.
You seen porn photos?
No, not porn. Everyone sees.
So I think what he's communicating is that his stories here were fictional, were made up. He's admitting that he hasn't had those experiences, but he's now telling us that he's seen pictures, and those are the things that he's referring to.
You saw photos of 2 girls in your year topless.
Yeah,
Would they be happy you saw those photos?
everyone else did.
Okay, so we're hearing that the pictures in question were of girls his age at school, and I think by implication, the girls did not consent, and of course, even if they did, it's at least illegal, I believe, in my neck of the woods to disseminate those photographs because they're of minors, of course.
I asked it, and now I'd like to know what it felt like to see her like that.
What, you're asking whether I got a harder?
I'm asking how it felt.
I liked it. Are we allowed to talk like this?
So we're learning that Katie, the victim that was murdered, we're learning that she was one of the 2 girls that it sounds like leaked or revenge porn or something.
Right?
Well, everyone else said it. Who saw it? That's not just me.
Okay, so I appreciate this very subtle moment, actually, and it's something that women clinicians deal with a lot more than men do. And if you didn't catch that, she asks him, did you like seeing that picture of Katie topless? And he's saying, well, kind of, but not really. No offense, she was flat-chested. So I think what we're being told is that he's noticing her body and he is commenting on it in a sense, or at least he's revealing that he has noted her body in that way. And although that's not an extreme behavior, there's more extreme. So as a supervisor and a professor, I would have the vast majority of my students and trainees and supervisees and colleagues, for that matter, are women. And they will occasionally tell me about scenarios in which they will have clients, and sometimes they will be teens, will be objectifying them, sometimes in extreme ways. That can happen to men therapists too. I've heard those stories. I think we're just getting a little glimpse into that. I don't know. I just thought I'd admit it. And there's various different ways of approaching that. Of course, for the clinician's safety and well-being, they can draw boundaries around that, of course. But it also is material for therapy. If someone is engaging in that, why are they doing that? What does it indicate? That sort of thing.
No one will send him any of her pictures because he wasn't careful with the one he got. The twat.
So you think he should have collected more pictures from more girls before he shared them with other boys?
Yeah, another interesting, subtle moment in the script that demonstrates a very common misogynistic, sexist notion in our society. I don't know UK mainstream society, but I do know my neck of the woods in Seattle, and I'm born and raised here, and so I can tell you for sure that when I was a kid, these attitudes, the foundation of what he's talking about, was present in the 70s and 80s for me. And we like to think of ourselves as having progressed in that time since then, and we have in a lot of ways, but when it comes to this sort of thing, it hasn't progressed enough, let's just put it that way. And there's a possibility that in some cultural sub-pockets, it has gotten worse in some ways. It's just hard to gauge this. But anyway, so what he is talking about is how, he's being honest, that with his friends, he would have preferred if they wouldn't have revealed that they were getting their hands on these photos without consent from the girls, or at the very least without the consent of the girls to disseminate those pictures, right? Because then they could see those pictures more often, And when I was growing up, this was mainstream. Today, it's not mainstream, although it is mainstream in the locker room, so to speak. It's mainstream among men and boys to talk like this, but it's not mainstream to depict it in a glorified way. And like, I just remember movies like Porky's when I was a kid, and how the heroes of the movie would break into the shower and spy on the girls in high school or even younger showering, right? And this was considered normal, okay, acceptable by everybody. This movie at the time, and many other depictions along these lines, like Stripes with Bill Murray had a scene like this. It was a very common way of getting a laugh or having a titillating experience in a movie to titillate the audience, that kind of thing. It was also a way to signal that the men doing the spying are proper men because they're interested in those sorts of things.
I just don't know why you don't say the things normal people say.
You thought I should have contradicted you when you said your dad was ashamed of you, and you think I should contradict you now when you tell me you think yourself ugly?
Okay, just very briefly, I will say that, one, she is conducting a psychological assessment, so she is not there to reassure him or help him or provide counseling or to provide any sort of healing or nurturance, unless it is in the effort of gaining an assessment and gaining data so that she can write her report. The other thing I'll say is that for therapists as well, case-by-case basis, but generally speaking, we want to avoid reassuring people, particularly in the way that people tend to do in society. He just said that he doesn't think that girls his age would be attracted to him, and he says that he's ugly. And of course, for any of us as watchers of this, as citizens or as a friend or a family member of his, we would want him to not think that because it is destructive to him and potentially inaccurate, right? There's possibly a fair amount of girls that would like him in a sense. I don't know that, but there's that. And so we have this impulse to erase that thought from his head and say, no, you're not ugly. And maybe that would help if you're his mother or father or friend or whatever, maybe that would help. But as a therapist, we want to be careful about that and be very hesitant to do that sort of thing because, one, it implies to the individual that you can just erase a thought by telling them the opposite. And it also invalidates their feelings to some extent, right? Like if you're talking about how you're really, really sad about a breakup that happened recently and you're telling your therapist this, and you're just demoralized, you're just like, oh, I just feel like I'm never going to meet another person like that. And your therapist immediately says, oh, no, you'll find someone. It's just a matter of time. Well, to you, the person suffering from grief and loss, you know that your therapist doesn't know that for sure. There's no way anyone would know that. So immediately you wonder, well, why would the therapist say that? Well, one conclusion is the therapist is saying that because the therapist is anxious. We often will say those kinds of very quick, reassuring things because we're noticing someone else suffering, whether it's a client or a friend. We don't want them to feel that way. It makes us anxious for them, and it also makes us anxious for us because if we're his parents, we might think of ourselves as a failure if our kid thought this about themselves. And so we, in a very ham-fisted way, will just bring down this sledgehammer of reassurance and say, no, don't think that way. And again, case-by-case basis, but it can be very, at the very least, it's not necessarily helpful, but it also could be harmful. It could actually result in the child absorbing your anxiety and learning that they can't talk about that sort of thing with you because they don't want to make you feel bad about yourself, that sort of thing. So even if she were a therapist, she might respond this way, but particularly because she's conducting an assessment, then she should definitely avoid trying to reassure him because she's trying to get at the truth. She's trying to get at the way he thinks and feels. She's not trying to help him. And I worry that people watching the show will think that this is a therapy session. And I'm pretty sure that the showrunners, the writers, understand that line because it's been upheld up until this point, meaning that she hasn't done anything inconsistent from a forensic psychologist. Let's take a break here and tune in next time when I continue watching. And everyone out there, please take care of yourself because you deserve it. You really, really do.